Okay. I haven't received message from Shahnila.
Jay, I believe we are live.
Yeah, okay. Okay, Assalamu alaikum. So today we are here with another episode of fortnightly PUAN webinar series. The title of today's webinar is Combating COVID-19 with Big Data and Artificial Intelligence. And I'm very excited to be with very inspiring panelists today who have done very impressive work in their own domains using big data and AI. So we will start the session with short introductions of our panelists, followed by the details of their work in their own words. And then we will talk about their contributions and their role during COVID-19. So first of all, let me introduce our panelists. Our first panelist is Dr. Izza Aftab, who is a Fulbright alumna. Dr. Izza is an assistant professor of economics at the Information Technology University in Lahore. She is the founding chairperson of the economics department there. Izza is the architect of two cutting-edge degree programs, MS Development Studies, Development, Technology and Policy, and BS Economics with Data Science. Izza's research covers many areas, which includes economics of innovation, SDG, CPEC, and child protection. Izza did her doctorate in economics from the New School in New York in 2016. Our second panelist is Dr. Umair Sajjad Hashmi, who is a Fulbright alumnus. Dr. Umair did his PhD from AI for Network Research Center at University of Oklahoma in 2019. And currently he's working as the assistant professor of electrical engineering in the School of Electrical Engineering and Computer Science at National University of Sciences and Technology in Islamabad. Dr. Umair is working in the broad area of 5G networks and application of artificial intelligence on optimization of wireless networks performance. Since the start of COVID-19 pandemic, he has been working on many projects with the National Institute of Health, both in US and in Pakistan, and as well as with the University of Oklahoma. Our third panelist is Tughral Turab Ali, who is a Kennedy Center alumnus. Tughral is working on enhancing financial inclusion amongst the underserved using the power of digital finance services. He was part of the team that launched Pakistan's first mobile money service. And then he went to lead microinsurance in several African countries. He returned to Pakistan to launch a digital wallet for a microfinance bank. He has also launched e-commerce platform to connect small farmers with buyers and sellers while he was working with the telecom. He is currently working as the head of Asia Pacific for an American microinsurance company and is based out of Lahore. Tughral holds an MS in Management Studies from MIT and an MBA from Warwick Business School. So before we move towards the question answer session, let me introduce myself briefly. My name is Sadia Shakeel, and I am also a Fulbright alumna. I did my PhD in 2016 from Georgia Tech. And currently I'm working as the assistant professor of electrical engineering at the Institute of Space Technology in Islamabad. And I am also an adjunct research associate with Monash University, Australia. And like our panelists, my work also involves a lot of work with AI and big data. I'm working with health-related data, human body and brain data. And I actually try to predict, model, and analyze data from neurological disorder, for example, Alzheimer's and stroke and brain tumor. And we are also working on development of wearable devices for patients using this data. So with this introduction, I will move towards the first question, which is from all of the panelists, and that is, I would like all of you please to, first of all, welcome to the webinar. Thank you for being here. And I would like to all of you to tell us one by one about your work. You are doing tremendous work. So we would like to know what you are working on, and then we will move towards what you did during COVID-19. So we will start with Izza. Ji Izza.
Thank you, Sadia, for that very generous introduction. It would have been fair that the three of us would have gotten a chance to introduce you and do some notion of justice to you. But such is the joy of being the host of the webinar. You've told a lot about the sort of work that I do, but if I want to try and sort of synthesize it a little bit more. I'm an assistant professor here at ITU, and I'm the head of the economics department. All of us know that by now. But the work that involves a lot of data that I do is the work that I do at the Sdg Tech Lab, and that I helped set up at the university in collaboration with the UNDP and the UNFPA. And the premise of that lab is to leverage technology and data to help Pakistan achieve the different sustainable development goals. Because Pakistan is a signatory to the goals, and we've ratified that in our parliament, but our performance on the goals is not particularly impressive. So one big part of the project was where we used satellite imagery, and that's the work that my colleague Dr. Mohsin does. And interestingly, Mohsin is a faculty member in the computer science department at the same university, and he did his PhD also on a Fulbright from University of Florida. So his main area is computer vision. So it seems everywhere Fulbrighters go, we seem to find each other. So Mohsin and his team, so the work that we do there is sort of multidisciplinary. Mohsin and his team identified and mapped slums in Lahore, and we use the convolutional neural network to do as much. And then my team goes into these slums and we do a detailed survey, and we develop a development profile of each household. Then we aggregate it up to the slum itself, and we can rank the different households in the slum and different slums in the city. And the idea is to be able to identify very targeted micro level policy interventions, and that helps the provincial government as well. We trained our algorithm. We used administrative data that the LDA made public. So we used that to train the algorithm. Then we did the same thing for Hyderabad, and we got in touch with the Sindh Kachi Abadi Association for that. They gave us a bit of administrative data, which helped tweak our algorithm a little bit more. And we did the same thing for Hyderabad. And then we let the algorithm run on its own in Peshawar, and we detected slums in Peshawar, and Peshawar is very challenging. As I'm sure you know, that the way the urban landscape has changed in Peshawar has changed drastically since the war on terror began. It's very different from how Lahore and Hyderabad look like. So we did a lot of primary data collection there. We established these nice data sets where we know where the slums are in the cities, and we know where the points of intervention are. We know what the asset holding of people in different slums is, and that helps us rank them in different capacities and forms. So that's been a big thing, and that the work that we did through the lab for the UNDP has helped us do some interesting work during the COVID, which involved a bit of interventions for social enterprises like RISC. We told them where to go, where their food intervention. There was obviously a lot of people wanted to help, but they didn't know where to go. So we helped us with that, and we did a bit of work for the Sindh government as well, telling them where pockets of poverty were in Karachi, and that helped inform the decision about cash transfers. And I'd be happy to talk more about that, but I think this would be an ideal time for you to move on to other panelists.
Thank you so much. It's very interesting, and I'm looking forward to talk more about these incoming questions. So now I would like to ask Dr. Umair about what he has been doing with his telecom sector, 5G networks.
Yeah, thank you, Dr. Sadia, for the introduction. And yes, as you mentioned, I am currently working as an assistant professor at the National University of Science and Technology in their School of Electrical Engineering and Computer Science department. And yes, my area of expertise is 5G with application of artificial intelligence in that. And broadly speaking, from my research point of view, I do system level simulation, system level analysis, and performance enhancement of current and future generation cellular networks. The KPIs that we try to manage and enhance are spectral efficiency, energy efficiency, latency. So we're looking at how to improve the user quality of experience strictly from a telecommunication based perspective, but by taking into account the user generated and the network generated data. Uh, a lot of my work with this ongoing pandemic, we tried to see how we can leverage those big data techniques or AI in applications that are specific to this COVID-19, and also in a way to help Pakistan basically deal with this pandemic. So I'll briefly talk about the projects. Obviously, we can talk in detail later on as well. So I was working with three different initiatives. Specifically related to COVID-19. So the first project that I was working on was with the University of Oklahoma and in collaboration with National Institute of Health. And that was basically for early diagnosis of COVID-19 using cuff-based analysis. So the primary implementers or the principal investigators of this work, those who have researched on it and designed the solution for this is the lab where I graduated from in the University of Oklahoma, where I completed my PhD from. So they've basically designed a solution, proposed an architecture, and then designed a solution for AI-based COVID-19 early diagnosis. The model basically constitutes of different units, cuff detection and then cuff diagnosis. And basically, we have multiple layer deep learning based architectures which are analyzed and then also joined in parallel to analyze patterns or features in cuff samples, and how it would differentiate for COVID-19 in relation to other similar diseases as well, pertussis, other respiratory illnesses. So they've designed this deep learning based model. Obviously, since we did not have enough data for COVID-19 specific cuff samples, so the beta version of the application is already there. And right now we're trying to work in collaboration with National Institute of Health in Pakistan in gathering a lot of data, and then we will try to implement it within the Pakistan region. So that is why we are that is what our role is in this project. Number one, trying to gather enough data, and then helping the research team improve the model, and then its implementation within Pakistan. So that was regarding the first project.
Thank you.
This the the second project that we're doing. I hope I have maybe 1 or 2 minutes to talk on that.
Yeah, sure, sure.
The second project that I'm doing is regarding COVID-19 symptoms and preventive isolation tracking dashboard. This is with a team at National University of Science and Technology, and what basically inspired us to do that project was the need for efficient and smart lockdowns. Obviously, in a situation and a pandemic, what Pakistan is facing, it's not possible to go with a complete shutdown of the country, because that would have economic repercussions, very severe economic repercussions. So this basically, the dashboard that we've created is basically an idea or a beta version of of an idea of how we can implement strict or smart lockdown by getting crowd-based data on COVID-19 specific symptoms that public is facing. So what we did was we created a district-wise map showing COVID-19 cases, recoveries, deaths that are growing, and also based on the symptoms, the probability or a score that is showing how COVID-19 is more prone to spread in a particular district in Pakistan. So we performed that for entire Pakistan. We collected data through questionnaires and then did the modeling behind those to then come up with which district is more prone where smart lockdown strategies could be implemented. And obviously that could trickle down on a city level as well. So that was the other thing that we did. And finally, the last project that I did that we're working on right now is with National Institute of Health in Pakistan and USA. And that is for on estimation of influenza epidemics using Google searches and autoregression based models. So we've seen that simply by searching or tracking how people search for different influenza based terms, we can actually accurately model how it is spread in different countries. That has been accurately done, and results have shown that those tracking based models are actually quite close to the true cases. And this is what we're trying to do with the help of NIH USA, and trying to gather influenza-like illness disease data in Pakistan, the reported data, and also tracking the Google trends to see if we can make reliable models of the influenza-like disease spread. Obviously, with COVID-19, there has been an enormous interest within the public to do searches. So we're getting some really interesting results in that as well.
Okay, thank you so much. Very impressive, and we will talk more about them. So now, Tughral, so could you please tell us something about your work in microinsurance, and what are you doing, what have you been doing?
Sure. Thank you very much for that introduction also earlier. I was listening to Dr. Aftab and Dr. Hashmi, and I was thinking to myself, I don't know if this is a coincidence, but you've put together a panel that is so relevant to me on a professional basis. The work that I do is around digital financial inclusion. Really it's about, bridging the inequality gaps. But doing it using technology. So we have used, the work that I've done in the past has included the launch of mobile money, moving on to microinsurance, moving on to microfinance, and all of this was being digitized. And now currently I'm working again on the side of microinsurance, where what we're trying to do is micro size risk protection and distribute it using the mass distribution channels like telecoms or smartphone applications. Use them to get these covers applied as wide as we can across the population. And interestingly, one of the things that we've also been working on is weather risk insurance. So as you know, that climate change is happening, and because of that the rainfall patterns are changing. The people it affects a lot are the small farmers, who see year on year they become very vulnerable to these changes in the patterns. So we worked on a parametric rain insurance cover, which basically involves virtually no interaction on the ground at all. So people, farmers, once they've signed on, we have their geolocations, we use satellite data. And we track and monitor what the rainfall patterns are in that particular grid. And if there's a trigger that's been met, whether for drought or for excess rainfall, there's an automatic payout that is generated for that farmer. And if you plug that in with a mobile money platform, that virtually means that the claim doesn't have to be filed by the farmer. There's nobody who has to physically go and verify if the claim has happened, because we already have that data at the back end. and then the payout doesn't go through a middle person or any third hand. It basically goes directly from the insurance house to the farmer's wallet. Now this work is something that we've been doing. Microinsurance, microfinance, mobile money, digital wallets. This is something that I've been doing over the last 10, 11 years. And more if you include my work on agriculture as well. But I think it's never been as relevant as it is today with COVID-19. Because it's changed the way people interact, and there's a lot of focus now on digitization. So suddenly we want to digitize money, we want to digitize money transfers, we want to talk about insurance, which is parametric, which doesn't involve people on the ground, meeting each other from a distance. It can be implemented from a distance, and even microfinance, where banks are lending. So that's the kind of work that I've been up to. And I think if I look ahead at the coming decade, I think based on the work that Dr. Aftab is doing and Dr. Hashmi is doing, I mean, they're really creating the pipeline for us to deliver these services over. But based on that work they're doing and the rest of the industry, the direction they're moving in, I see that digital financial services will become a reality in Pakistan and beyond very soon.
Okay, thank you so much. So, so very impressive. Again, I am using this word so many times because all of you are impressive. So next, I would like to talk a bit more about motivations of Dr. Izza talked about a project that she did during COVID-19. Dr. Umair also talked about, and Tughral, you also talked about the possibility of everything digitization being useful more in perspective of COVID-19. So I would like to just ask a bit more about what motivated everyone to start the projects that they are doing during COVID-19, and how did everything come up? For example, like COVID-19 was not something planned. So most of the time when we start some project, it's already planned. I think about something, I think about Alzheimer's disease, I think, okay, I should work on this. And then I start to take data and things like this. But this was something that was just pushed over us. So what motivated everyone to take some new projects or to continue working on the previous project, and how did it progress the different challenges and different scenarios? So this time I would like to start with Tughral maybe, because you just talked about that these digitization projects would be very useful during COVID-19. So which projects? Okay, so you just talked about the projects that in which the insurance company is directly connected with the farmers and they don't need to go there. So did you continue working with this project during COVID-19 also? And if you did, how did it progress, or how was the reaction of both the parties?
So, like I mentioned, I've personally already been working on the side of digital financial services for some time. So this was the objective anyway. What I did witness over the last 6 months, once we've had these lockdowns start to happen, is that the change, the rate of change or the pace of change has accelerated. And it's primarily happening because businesses like insurance houses or large banks which are lending, or e-commerce platforms, they're suddenly realizing that the world has changed in a way that old methods of doing business are just not going to work, and they need to bring in digitization to overcome these barriers which are now coming in, the physical barriers which are coming in. So the result of that has been, like, for example, we were trying to work on digital insurance, weather-related insurance for small farmers in Sawabi. This is something that we were doing, and this was back in February. So we had gone there and we talked to the farmers and spoken about their insurance needs. What's happened in the 6 months since is that the demand has actually gone up, because now there's a realization that, look, parametric insurance is something that will allow us to bypass a lot of the physical barriers which have now come into place. Because we talk about field deployments of agents, it's becoming a challenge for them. Similarly, I see changes happening on the personal line side. So, I'm talking about the agriculture insurance vertical, but if I look at the personal line side, where you're talking about health insurance, life insurance, you'll see a lot of products which are specifically designed around COVID-19 now being distributed to the mass market. So that's the insurance industry now responding to this new challenge which has come up. The motivation, was always the same. The motivation was really about giving people risk protection. It's something that I had been working on for some time. But I think what has changed now is the response, because we see that the market now understands the need for it. They understand why digital is necessary. So I'm actually quite positive. There are challenges though, and maybe if we have time, we'll talk about them later. But there are challenges around delivery of digital financial services. So it's not all roses and white clouds. We have challenges when it comes to how people relate to these products. Do they understand them? The uptake, the willingness to pay for them, because they have to realize the value for it. So on the business side, on the distribution side, there's a lot of work to be done, but it's moving in the right direction.
Okay, thank you so much. So in a way, COVID was good for this, but again, with some challenges.
I will never say that. COVID is bad. It shouldn't be here. But no, I mean, I think what it's done is it's a catalyst. It's a catalyst now for change.
Yeah. Okay, so my next question is with Dr. Umair. So you talked about all of three of your projects that you did during COVID-19, and they are all three very interesting projects. But I am wondering, how did you pick these three specifically? Because they are not directly related to your telecom sector. And then there were so many things happening. Like when COVID started, I also thought about some products, some projects. And then I also tried to apply for some fundings and everything, but there were so many things. Whatever I started doing, I thought that everyone else is doing that. And then I just stopped. I'm like, okay, everyone is doing, so maybe I should switch to something else. And then by that time, it was already 3 months into COVID, and then it seemed everyone has done everything. So how did you come up with these specific projects?
So I think, first of all, a lot of the things that we're working on, the technologies, the models, the methodologies, they've already been there. And really, our role was basically just transferring them from one domain to the other. So, for example, if we talk about cuff-based detection of illnesses, that's been there. And already people at my lab, they were already working on cuff-based solutions or cuff-based detections of other diseases. And suddenly now, when the COVID situation just comes out of nowhere in the early part of this year, then obviously the interest grew whether to see if those models or those schemes can be reapplied or basically to see if they can actually be reciprocated in this COVID specific disease detection, early diagnosis of that. So that is where this inspiration comes from. Similarly, for crowd-based data solutions are already there. They're in place. They're used for multiple applications. But to see how they can be useful specifically in a Pakistan-specific environment where we cannot have a complete lockdown strategy and we need to have smart lockdowns where we're only restricting movement in certain areas of the country or a city where there's a larger chance of the pandemic spread, how to come up with that and how to preempt that. A lot of the movement that we've seen, a lot of the reaction that we've seen was very, very reactive in the initial part of this pandemic when it spread, not just in Pakistan, but in other parts of the world as well. But slowly, gradually, I think governments, institutions, they came, I think, to a consensus that the only right solution for that is a smart lockdown strategy. But which regions to sort of restrict, that sort of thing we can actually use from a crowd-based information. And those it was not just, I think, my effort. It was the entire team, my collaborators as well, my students as well in some of the projects. So a lot of the ideas were not solely my ideas. They were basically different team ideas that we were working on and then implementing. Similarly, those Google Trends based project as well. So we already have different models that predict how influenza like diseases spread in different countries, and those have already been there. But when it came to COVID-19, we saw that the patterns had changed. They had completely changed the dynamics of how real-time tracking takes place, because we had not seen anything like that in the previous 100 years at least, a pandemic to that level. So modeling such a disease or such an activity is obviously a challenge, but we've basically we're coming to terms with how to improve our models in accurate estimation, accurate detection, what different data parameters we need to use. For example, just if we only take Pakistan into consideration, we need to take into consideration different parameters like the number of casualties in different districts, what is the capacity of the hospitals, how many patients are critical in a particular time, how do they change over days and weeks. So trying to understand how that affects these kind of models, and coming up with more accurate models, I think that was a challenge. But I think really a lot of it was already there, and it's already part of our work. We applied it in telecommunication sector before, but since this COVID-19 situation demanded, not just from a research point of view, but also from a public service point of view, that we try to implement and come up with methodologies, with models that are accurate and that can help public in general. That is what basically motivated me and my collaborators to try to pursue that domain.
Okay, thank you so much. So it means we need to look into the connections of what already is there and what can be done with whatever.
Yeah, you can't start from a scratch when
Exactly.
these things happen. Yeah,
that's true. Thank you so much. So Izza, so your actually project is I'm actually very intrigued about your motivation behind starting a multidisciplinary project. Your project is very multidisciplinary, and then you are focusing on inequality in the society, on the slum areas, and this is something very unique to me, that someone is so much passionate about these kind of projects. So what motivated you to start this thing in the first place, and then what motivated you to keep on going in this direction also? Because starting something is maybe not that difficult, but just keep on going in something that is so difficult is kind of not everyone's task. So we would like to know.
Thank you, Sadia, for that question. I think I have a Tughral and Umair sort of set a very, very high standard. I don't think my story is quite so impressive, but I'm going to take a crack at this. I work a lot with data. I'm very intrigued with technology. You mentioned this program that I, spearhead, which is the MS in Development Studies, and I teach a core course in it, which is very unimaginatively, I call it technology and policy, right? And it's a core course for my degree where I talk about both things to the best of my ability. But okay, by training, I am an economist, and economics is not just about supply and demand. It's not what these mainstream econ programs make it out to be. It's not about optimization. Economics is a social science, and that means that I'm convinced that people are more than just statistics, right? So saying 37% of Pakistan is malnourished is not just 37% for me. When I hear that figure, I'm thinking, oh, okay, so 37% of the people that I live with are not getting enough caloric intake. This is how it impacts their learning. This is how it impacts their learning outcomes. This is how it impacts the sort of labor they will be. This is how it impacts their tendency to be innovative and entrepreneurial. And ergo, this is how it's going to affect this particular subsector of the economy, which will impact growth in a particular fashion. So in economics, things are sort of linked to each other. So that's the backdrop that is there. Sort of focusing on slums, it's slums is it's a very difficult thing to define. Everybody defines it differently. There are like 80 different definitions, and if I was to ask the three of you and a bunch of your participants, everyone will define it differently. So sort of, but that's where methodology comes in, and maybe that's a conversation for another day. But inequality is something which is a big problem. It's something that I think is morally unacceptable. I think the logic that inequality is needed for economic growth, economic movement, is a faulty argument. Um, I think it's unacceptable to be able to live in a society, to put together an economy or a society where there are haves and have-nots. That doesn't mean that everybody should have the equal amount. That's not what I'm saying. I'm saying you need to be able to create a system where people can opt in, right? And if people can't opt in, that's when you fail. People can choose to not opt in. I should be able to respect that, but I need to be able to create a level playing field. And the thing is, when you think of slums, like everybody else, like when you collecting data in Pakistan or anywhere else in the economy, we split the economy into quintiles. So we look at the poorest 20% right up to the richest 20%. Folks in slums don't appear in data collection in Pakistan, which means you can't make policy for them, which means you can't achieve policy goals in Pakistan. It doesn't matter whether you leverage technology, you change a political party or whatever. If you're not counting all your people, that's going to be a problem. So for me, it was extremely important to be able to bring into the fold all of those people which I think were not in the fold. And I knew what the economic data looks like. So I think that's why we looked at slums. It was a conscious decision that me and my team undertook, and we then sort of parked it under the 11th Sustainable Development Goal, which focuses on making cities inclusive for all. So that was my very unimaginative way of trying to make a little dent in what's happening in Pakistan.
Okay, thank you so much. So, okay, so we have not much time left, so time just few. So I would like to just ask a few more important questions. Tughral was just talking about challenges, so let's move to what challenges did you face? I know we all face challenges in research, no matter what kind of research we are doing. And there are so many challenges already in research, and COVID actually added to those challenges. So I would like to ask each of you about your own personal challenges. And like, for example, when I started to work on some projects in COVID, which I actually couldn't continue because of those challenges. For example, there was the challenge of communicating with the students or the researchers who are at different parts of the world, and I am here. There was a challenge of resource acquiring, the hardware acquiring, because everything was closed. I couldn't connect to the servers in the university because of internet issues and so many other issues. And then there was a challenge of data collection also, in fact, specifically because of COVID-19. And all the projects that you are working on need a specific kind of data. For example, for Izza, it's going to slum and then collecting the data about knowing the questionnaire. You talked about identifying the poorest region of the slum in order to distribute the money. So it needs the data to be collected by going there. And then Tughral is also working with farmers' data. Dr. Umair is also working with data that is collected for like cuff data and those. So that actually is to deal with the hospitals and those resources. So one challenge that I think is always there is data collection. Then due to COVID, there was this challenge also, lack of self-motivation, lack of kind of, for me, it was very difficult to have a schedule for myself and for the team also, even for the project that we were doing before also. So I would like to ask each of you one by one, what were the challenges that you faced and how did you deal with those challenges? So I would like to start with Izza this time.
Great. Thank you, Sadia, for that. I think everybody felt the brunt of the internet connection that was fairly terrible. But that's something that all of us felt. I think so. Here's the thing. I run the economics department. I run a couple of research labs. So मेरे साथ ये हुआ था that all my waking hours became working hours, right? So that very little period of time that I would have to myself, that sort of evaporated, and so there was a lot more work that had to be done because we had to sort of keep the students calm as well, keep the research teams calmer as well. So on a personnel front, it was I think I learned a lot. I grew a lot. You know, when you have a leadership position in a university or an organization, there's a lot of responsibility on you. And then when such challenges come, you learn a lot about your team, about yourself. But as far as the data thing was, data part was concerned, I think that was the simplest part. Like we sent in our researchers, our research team to the university, and we said, can you connect the GPUs to a backup UPS, and you make these changes to the network so that you can access them remotely. So that part of our research remained rather unaffected. But on a personal front, there was that, and I felt obligated to chip in my 2 cents to the public debate. I thought it was important to engage with the public in general, not just academics. I think that's a problem with being in academia. We sort of stick to our silos and we don't engage with each other. I mean, you and I, every time we meet, it's very pleasant and then right, and then we sort of go back to our own burrows. So I started writing a lot more for the public. So I started engaging more with newspapers, trying to explain the concept of inequality and how it was exacerbated. Why exactly was it exacerbated? That meant I had to devote more time to work, but that was something I hadn't necessarily felt before. So there was a time for a lot of introspection and maybe changes for the better. So yeah, but work increased disproportionately for me, disproportionately. Yeah,
that's very true. So thank you, Izza. So yeah, I totally agree with you that every waking hour became a working hour because there was no timing for going to sleep and waking up, and I felt as if my mind was always awake. It was always thinking about something, and maybe too much of the screen time also added to that. So okay, so now I would like to pose the same question to Tughral. Can you please tell what were the challenges and how did you deal with them?
Sure. So I think on the business side, because I'm looking at it more from a business perspective, there were a couple of challenges that we saw. I think it's pretty universal. One thing that we saw was speed with which, because we depend a lot on our distribution partners, the speed at which our partners were responding to us slowed down significantly, and that was primarily to do with the uncertain economic condition that had been created. So that was, one of the things that, of course, then it has a cascade effect on, your own ability to roll out, go to market. But then there was, I think, on the side of the end customer himself or herself, and now we're talking about the small farmers, the mass market, as we like to call it. I think over there, the challenges that come in are primarily around, okay, so we realize that the speed of digitization has increased. The transformation is happening really quickly. But we sometimes, I think, forget, especially in the business world, we forget that we're talking to an audience which has never experienced services of this kind before. You know, and a lot of the product design which is happening, the design of distribution which is happening, is being done in big boardrooms, you know, done by people who've never really lived the challenges that the mass market does. And so there are a lot of assumptions that we have about what is really value for them. And when we approach it from that point of view, you know, and you get to the market, you suddenly realize that, you know, the market is thinking about this in a very different way. You might think, I'll quote a very quick example, and again from microinsurance. When I was working in Africa, we came up with a life product, and we thought that, you know, this life product would be something that would, you know, be swept up, because funerals in Africa, just like in Pakistan, they're quite expensive. So we thought that, you know, it's being delivered over the telecom channel, mass distribution, why wouldn't people take it up? But we saw very little uptake. And so when we actually went and talked to people in the communities to understand why, I discovered that they said, well, okay, you know, the way culture works in my country, in my village, is that when somebody passes away, if there's somebody who's passed away in my household, the entire village will get together and they will pool money and they'll give it to us. And so that helps us with the funeral expenses and to, you know, smooth out the bumps. It'll happen also when there's a serious hospitalization. So again, the community will get together. And the expectation then is that if my neighbor goes through the same thing, I will then respond in kind. You know, I will also do the same for him or her. Now, what this is actually insurance, except that the premium is being paid at the time that there's an incident. And compare that with us when we bring in formal insurance and we say, no, you pay in advance for something that might happen over the next 6 months. So that's an equation that needs to be flipped in their mind. So I'm just giving that as an example to just say that, you know, there are challenges which are around the business itself, delivery of business, the speed, and that's impacted by COVID-19. But then there are challenges around the design of the value itself that you're providing. And over there, those challenges aren't about to go away very quickly. That's a transformation which will take maybe 5, 6, 7, 10 years when, you know, more and more people are, you know, are delivered real value, when we build their trust in formal financial services, when we move from a transactional mindset to a relationship mindset. That's where that transformation is going to happen. So yeah. So I don't know if that was that answered your question at all.
No, it does, and very interesting. Like I'm very impressed how you mind things about integrating, connecting actually the dots. From like the example of African, you found that this is what, and this may be the way to actually make them believe that insurance would do the same thing that they have been doing for each other. And this is a very unique way of thinking and facing the challenges and then taking care of them as you move forward. So very interesting. Thank you, Tughral. So now I would like to move to Dr. Umair with the same question. What kind of challenges did you face, and were they different from the challenges that you normally face with your research and work?
Yeah, I think it's very interesting. Initially, when this lockdown started, I think around mid-March, I was pretty relieved at start, because at that time we were not sure as to how long it's going to go. We were not sure as to how bad the impact it's going to have on the economy, on the health infrastructure, how severely it's going to impact us. So initially, I mean, I was pretty. I thought maybe it's a 1 or 2 week thing, maximum 1 month. So I was pretty relieved, because it saved me from the couple of hour commute that I used to do every day, back and forth from my work to home. But very soon I realized, and I would basically agree with Dr. Izza over here, that it turned out to be more of a hassle, because your overall work time, that increased, the amount of family you have to focus on, that increased, and the entire ecosystem of the education completely changed, shifting from a face-to-face communication based system of education to a completely online based system. where we had to first decide on what platform to use, how to communicate to students. Since we're from an engineering background, how to help student with numerical based concepts. That was a real challenge. And right now, just before this session, I was having a discussion with my students. We're having they're having their final exam soon. So how to conduct those assessment, that is also a challenge, not just for the students but also for the instructors, for the IT staff. So this is a first for everyone. So how to smoothly conduct the education as well as the assessment methodologies, I think that has been a challenge. But I think it has also been a learning experience. It has also been a great learning experience because earlier we were not exposed to such kind. We did not even know that that could happen, and we could actually be communicating from a remote place to our students. I mean, obviously, we used to have different project discussions with our collaborators who were in different parts of the world, but having to teach a group of 60 to 70 students and trying to sort of teach them simple concepts using online tools and show them how a particular equation works, that was certainly a new. Just coming briefly, if I have a couple of minutes talking about the challenges in the projects. Obviously, you talked about data collection, and that is very very relevant, particularly for the cuff based detection project, because um, uh, we saw how badly the health infrastructure was impacted in Pakistan. So I got in touch with many different organizations, with hospitals, with quarantine centers in Pakistan, and they were already heavily burdened. Their staff, well, they were already understaffed. The doctors were doing extra hour shift. So for them to take extra time in trying to create reliable data, because all of these projects, these AI ML based projects, they cannot run without data. Data is the fuel for
Exactly.
these projects. So getting reliable data is very important, and getting reliable data from centers where you have COVID-19 confirmed patients. You have so many risks. Number one, the risk of exposure to the doctors or the collection team. Then the doctors are all day and night trying to cover the patients, trying to sort of improve their situation. So this is an extra burden for them. And then if we even hire new staff with the help of AI engineers, we have to train them to ensure that they don't affect themselves and don't disrupt with the operations of the hospital. That was a challenge. And obviously our time in trying to sort of come up with the SOPs. We basically distributed brochures to staff. A team at University of Oklahoma that had already built a mobile application. Simply just use the application and simply record your cuff samples using the application. So that took this intermediary step out of that. Because in Pakistan, we still needed manual data collection because there was a problem. A lot of people did not have, number one, the internet facilities nor the right technology to use those mobile applications. And then trying to motivate those patients, because once you're actually going through such disease, you already have so much psychological emotional stress. Trying to basically disseminate data for this cause, that was also a challenge. And we really the team at National Institute of Health in Islamabad, they played a very very positive role in, number one, hiring the right people, and then sending them to those quarantine centers to collect the data, trying to motivate the patients to donate the data.
Very nice. I totally agree with most of the points, and then specifically that it's not only about these studies. We have to think about teaching and exams. Like I had a online exam yesterday from 6 to 9 p.m. And then one of the student was just not able to upload his paper. And it took me another half an hour just to trying to figure out how to make him send the paper. So yeah, there are unexpected challenges, and then there is learning also. So I totally agree. So, okay, we are all almost out of time now. So I will just quickly ask you the last question that now that COVID-19, we actually are hoping, and we are seeing that there is a drop in the COVID-19 cases, and we are hoping that, okay, we will be COVID-19 free in future, hopefully. So the projects that you started during COVID-19, do you think all of them, like it seems that some of them can continue into the routine life also after COVID-19 also, but some of them are particularly with reference to COVID-19. So would you be able to somehow modify them in a manner to continue working with them? And then do you have any idea how can we be better prepared for something like COVID or some other crisis in future as a nation? So I would like to start with maybe Dr. Umair this time, and then we will move to next panelist.
Yes, I mean, just building, just carrying upon your point. I think Pakistan itself has been a very positive example of how to quickly learn from its mistake and then go on implementing the right strategies in trying to tackle with this pandemic. And very rightly so, we're seeing a reduction in cases, and hoping inshallah that we see a complete eradication in the coming months. Yes, regarding the projects, obviously, when I say that, I mean, I really hope that we don't have to face such a situation anytime in our lifetime again. But for any other similar situation, those sort of projects or models or those methodologies could be implemented with necessary changes. For example, if we've seen in one of the projects how we can actually collect crowd-based data, how we can motivate people to let us know if they have COVID-19 specific symptoms, for example, in this case, and then trying to ascertain if a particular region has a higher tendency of a greater COVID-19 spread. Similarly, I mean, the same can be implemented for other social issues as well. If a certain section of society is facing injustice, if they're having depression problems or other issues, or simply if they have issues that they would like to highlight, those crowd-based initiatives could be very helpful, and we could actually use our analytics to see how different regions are doing on maybe those economic scales that Dr. Izza was talking about, or those social development scales, or how well they're integrated in from a technological perspective, something that Tughral Bhai was talking about. So those kind of things can be replicated, can be implemented. Similarly, we've seen we're trying to still investigate if we can come up with reliable COVID-19 based regression models, to see if we, number one, we come up with good models, and to see how they can be replicated to other diseases which might spread in the future. Then having those models readily available with us would actually help us in trying to predict how the increase is going to happen with those diseases. It's always good to have a benchmark in place when you're trying to do such analysis, when you're trying to build regression models or AI based models. So I'm not going to say that our success with these projects was 100%. Obviously, we could have had a lot greater success as well. But still, I would say that the initiatives that we took not only benefited us in finding out, in analyzing, and then maybe coming up with strategies that could help in this pandemic and the future, but those can be reused in the future as well.
Thank you, Dr. Umair. Izza, can you please share your thoughts?
Thank you for that, Sadia. I think आप webinar में अगर सिर्फ if you would have asked this question, that would have been really powerful as well. But you've wrapped it up with it, so there's a lot to think about. Okay, if you study the history of humanity, every now and then there are all of these exogenous shocks that hit the system. So pandemic this is not the first pandemic. This is not going to be the last one. The others might be a little bit more frequent, thank you to climate change. Uh, so all of these things are part of our reality. I think what this has done is it sort of jolted us and reminded us as people of our codependence on each other. I think it's been very humbling. We do a lot of firefighting, and all four people who present in this webinar have done a lot, they've grown a lot, and then the same is true for numerous and scores of other people. It was very humbling to realize that my welfare, my not getting the disease depends completely directly on you taking precaution as well. So it's sort of helped us sort of recalibrate how we even do theory, right? When we're doing theory, when we're doing these models, the regression models that Umair was referring to, they're based on certain assumptions where my decision is independent of the next agent's decision, and that sort of helps us rethink the importance of other important theoretical systems like the Bayesian network, so on and so forth. So I think at a personal level, it was that this realization. Uh, the next thing, like, and these are just my sort of last thoughts, and I'll stop talking after that, is whenever such a incident occurs in human history, it helps people realize that they have empathy, that they have compassion, and it improves the level of humanity there is in a society. So we step up. All of us come together and we step up. Whether it's in food drives, whether it's in cash transfers. Like I was very encouraged to see the Pakistani response by sort of putting a lot of focus on social protection. That's something that we've historically ignored. Um, and also, please bear in mind, behavioral economics documents the fatigue that comes in with abiding by rules, more so when it's about limiting your mobility. Mobility is a big privilege that people have, which they consider a right. So all of those things are understandable. But the fact that we can get our priorities straight was a message of hope for me. I'm a big fan of continuation of policy, even if it's bad policy. I'm a big fan of iterative policy. I think it's important to learn. I think Pakistan learned a lot. I think the world learned a lot. I think there's a lot to go from being a country that didn't have, ventilators and gloves and masks. We went to a surplus producing country very quickly. Like the lag that was there was really counted as a lag in economics. Um, so for me, it was a big win. It was a very big win. I was very impressed with students all across Pakistan. उन्होंने शोर मचाया, उन्होंने Twitter पे हमें जलील किया, सब कुछ किया. But I really liked that, they took charge, they engaged with society, they did their lessons. I was very impressed with teachers with so much of perseverance who taught, right? So much of regard for every stakeholder in Pakistan. So for me, it's a win. I think we'll forget some lessons, which is fine. But I think we'll have some important lessons which we won't forget. So yeah.
Inshallah. Inshallah. Very well said. Yeah. So now, Tughral, your last thoughts on this.
Yeah, thank you very much. I mean, not much more to add, but just very quickly, I think what COVID-19 has exposed is how lack of investment in infrastructure is going to catch up with you when things are, when you least want it to. I think we've been very lucky. A little bit of nature helping us out over here, or whatever it was. The numbers weren't what we feared they would be. The actual numbers might actually still be multiples of what we have officially, because there were so many people who just never got tested and never showed up on the radar. But I think the lesson over here, if I had some advice to give to the government, it would be that, look, we haven't made any investments in the infrastructure, be it physical banking, fiscal, whatever. We haven't done it over the last few decades. And it's left us very vulnerable right now. God forbid something like this happens again, and it is on a deadlier scale. I mean, this virus, it was very infectious, but thank God it wasn't as deadly as some of the other viruses can be. But suppose we end up in a situation like that. How are we going to respond the next time? So I think to the government, I would say that think this is the time we need to make those investments in catering not just to an elite group of people living in big cities, but think about the hundreds and thousands and millions of people who are living outside in the rural areas. What's the investment on the health infrastructure? What are we doing now to bring people into formal financial services? Because if you're not creating risk protection for them, if you're not giving them an avenue to actually put their savings away, you're leaving the population very vulnerable. So my advice, last word, is that look, the physical infrastructure is going to take. We've lost that race. We're very far behind. Leapfrog towards the digital side, because that's something that we can do quickly at a fraction of the cost that it would take to set up the physical infrastructure. And hopefully next time something like this happens, we'll be better prepared.
Thank you so much. Thank you. I wish we had more time, but we are beyond our allocated time. So, but thank you so much. And we are leaving with the message that this COVID-19 actually taught all of us something good about the fact that it's not about caring about yourself only, it's caring about everyone. And then because if you care about everyone, it is actually caring about yourself. So it's an interesting message, and all of you are doing that in a very impressive manner. So I would thank all of you, and then we will just finish this webinar. Thank you. Bye.
Thank you,